Hello, Assalamu alaikum. This is the fifth video lecture on the topic of thanatology. In the previous lecture, I mentioned that we will be discussing the sudden death, but it was not covered in that lecture. So, in this fifth lecture, I'll discuss sudden death and what are various causes of sudden death. Then we'll discuss in this lecture the certification of death, that how we certify death and what are the formats which are necessary to be adopted to prepare a death certificate, and what is WHO guideline and international format for preparation of the death certificate. Thank you very much. Hello everyone. Bismillahirrahmanirrahim. This is the fifth lecture on thanatology, and in this lecture we'll discuss sudden death and preparation of death certificate. So our learning objective will be that at the end of this video lecture, we will be understanding about what is sudden death and what are the causes of sudden death, what are the natural causes and what are unnatural causes. Then how we prepare a death certificate, what is death certification, and what is the criteria or international standards or guideline by the WHO on the basis of which we should prepare the death certificate. So international format of death certificate we'll try to understand and learn. So these are the learning objectives of this video lecture. So sudden death. As I told the students that every definition is hidden in the word sudden and death. That means death happening suddenly. So when we go into specific definition, it is a sudden and unexpected death. And the symptoms follow so suddenly and rapidly that from onset of the symptoms till the death occurs, the cause of death cannot be certified with certainty and confidence by the registered medical practitioner. So death and the sequence of events happening so suddenly that from onset of the symptoms till the death occurs, the attending physician cannot certify death with certainty. And every sudden death, as the chain of events is happening so suddenly that it arises a suspicion of foul play. And because this type of death may disguise a secret homicide. So all the sudden deaths should be subjected to autopsy or postmortem examination for the determination of exact cause of death, which is extremely important from medical as well as legal point of view. So what are types of sudden death? Sudden death may be natural due to natural diseases going on in the body, or unnatural. And the unnatural can be accidental, homicidal, suicidal, or poisoning. So the causes of natural sudden death, they may be in various systems of the body, like CVS, CNS, respiratory system, gastrointestinal system, or genital system. So the natural causes can lead to sudden death. And statistically, it has been seen that about 80% of the deaths are due to natural causes, and they are grouped according to the vital systems. So, system wise investigation should be carried out in locating the cause of death. In cardiovascular system, ischemic heart disease, this is the most common single cause of sudden death. Any predisposing erythematous coronary stenosis can be responsible for cause of death. And the area involved, the vessel involved may be anterior descending branch of left coronary artery, the proximal part of the right coronary artery, circumferential artery of the left coronary artery, circumferential branch, or short main trunk of the left coronary. So artery can be any, but atherosclerotic process going on can lead to myocardial infarction. Then hemorrhage from the vessel. And the outcome of hemorrhage depends upon the size of the vessel and the ability of the area involved to tolerate or accommodate the blood. For example, in certain areas, the accumulation of few milliliter of blood can prove fatal, like pericardial sac or the cranial cavity. So the type of vessel involved, that means the speed with which the hemorrhage is going on and the area where the bleeding is going on. So the vital areas like pericardial sac or the cranial cavity, very small amount of blood can prove to be fatal. And the extent of speed of hemorrhage is important. That all these factors should be kept in mind to determine the fatal period. Then there can be inhibition through abnormal stimulation of the regulatory nerve, that is the vagus nerve, that is the vagal inhibition. In deaths due to vagal inhibition, the onset is extremely sudden because of excitation of the stimulation at the trigger zones, and there is no positive finding at autopsy. Only the history, the circumstantial evidence suspects or suggests the cause of death. So, any interference at the trigger zones can lead to stimulation of the vagus nerve, and that will lead to sudden cessation of the heart. Then the causes in the nervous system, next to cardiovascular system, this is the most leading causes for sudden death are in the central nervous system. And it has been seen that the 17% of the cases of sudden death are due to diseases in the central nervous system. That can be hemorrhage in the brain, extradural, subdural, subarachnoid, or intracerebral. Then the causes in the respiratory system, allergics, infections, manifestation of glottis in diphtheria, then tumors of the larynx and the bronchi, pulmonary embolism, air or fat embolism, then causes in the gastrointestinal system, rupture or hemorrhage of gastric or duodenal ulcer, tumors of the stomach and colon, or fulminating viral hepatitis. Then the causes in the genital system, in the male, the trauma to the testes, and in female, rupture of extrauterine gestation, ectopic pregnancy, or rupture of ovarian cyst. Now about death certification. This is very important document which every doctor have to prepare during the course of his dispersing duties. So we should clearly understand that such an important document should be prepared according to the format which is given by the international or WHO standards. But why this is important, I'll briefly go into history, which is very interesting, though, that before 1816, the physicians were not well trusted in their ability to diagnose death. And there was a great fear of being buried alive. Then they developed in ancient Rome the call out phenomena. They used to call out the diseased persons 3 times, and if there was no response, they amputate the finger, and if no bleeding, then the person was declared dead. Then the Claude forceps, the French physician, invented a forceps, and design was such that it was clamped around the nipple, and if there was no response, the person was to be declared dead. Then to be fear to be buried alive. In 14th century, the Duke of Lancaster left instructions to keep his body in bed for 40 days. If the doctor still believed he was dead, then he should be buried. Then the magic words they used to write on a mirror with an invisible ink, which was usually silver nitrate. And when the decomposed body emitted hydrogen sulfide, the writing became visible as silver sulfide was produced. So that's how they declared the person dead when the person started putrefying. Then patent coffin came. These coffins make an alert. In 1897, they designed such a coffin that if there was a person who was buried alive and death was misdiagnosed and it presumed that the disease awoke from the sleep beneath the ground, a device was rigged to light a lantern, raise a flag, and ring a bell. So everyone should become aware. So this is a brief history. Then the invention of stethoscope. This was a great invention which settled the issue. In 1816, the physician was began to trusted in their ability to diagnose death by with the help of stethoscope. This is a history that in 20th century the change started in 1952 with an outbreak of polio in Copenhagen. 12-year-old girl underwent tracheostomy and put on ventilator. And the cardiopulmonary criteria was then based the death certification. And this is another case of Mollard, French in 1957, who reported on patient who had developed brain injury and were on mechanical ventilator for infinitive time. And brainstem reflexes were not present, and post-mortem examination revealed their brain liquefaction. In 1968, Harvard Brain Death Committee published a report on how to diagnose death on new criteria. And the criteria proposed that the patient could have no brainstem or spinal function reflexes. That is, the brain death should have to be established. And when the brain death is established, however, the patient is kept alive by artificial means, the death should be certified. That is, there is no spontaneous respiration, no spontaneous cardiac activity, A confirmatory test should be required for cardiac activity, that is ECG, and a ventilator technology advanced circulatory respiratory system could be maintained by means of the mechanical respirators, and despite loss of all brain functions, and thus have to be established brain death, that is irreversible loss of the brain stem functions. So then the person should be declared dead. So the brain stem death is the death of the vital respiratory and cardiac centers in the brain stem, which controls respiration and circulation. So brain death has to be established. Once brainstem has been established, no matter how healthy an individual is, life will not return to the patient even with continuous cardiopulmonary support. Now, with this much background, we'll talk about the death certification. Death certificate. The certification of death, which includes determination or diagnosis of death, is the job of every doctor. And death certificate is a legal document and has got lot of importance and should be prepared with care. It's a normal routine in our hospitals that in the column of death we write cardiopulmonary arrest. This is not the cause. This is the mode. So in the column of death, in the cause of death should be written, not the mode. Then the international format of medical certificate about the cause of death is that upon the criteria which WHO established, the medical certification of cause of death. That is, filling of death certificate form a complete biodata, and there are two sections headed, the section 1 and section 2. So basically, it becomes three parts. The first part is the complete biodata entry, and then the two sections, section 1 and section 2. In section 1, we write the 1A, immediate or direct cause. Then in 1B, we write the morbid condition which led to immediate cause. In 1C, any antecedent or underlying condition. So in section 1, we write 1A as the immediate or direct cause, and 1B, any morbid condition underlying which led to the direct cause, and 1C, any underlying condition. So this is what section 1. And in section 2, we write any other significant condition that can contribute to the cause of death. So section 1, diseases or conditions directly leading to death comes under 1A. And any antecedent cause or morbid condition which can lead to immediate cause in 1B, and any underlying condition in 1C. And in section 2, we write any significant condition that can contribute to the cause of death. So the cause of death does not mean the mode of dying. It means disease, injury, or complication which caused death. So few examples, how can we write the death certificate according to WHO criteria. If the patient had acute peritonitis due to perforation of duodenal ulcer, it would be written as 1A peritonitis for the last 2 days, 1B perforation of duodenum last 4 days, and 1C, duodenal ulcer. So it clearly meant the person was suffering from duodenal ulcer for this last 6 months, and the perforation of the duodenum from that ulcer happened 4 days previously, and for the last 2 days, the person is suffering from peritonitis, which is the immediate cause of death. So there would be written none in section 2 because there was no condition which was contributing to cause of death. All that is required that the precise cause of death should be set out starting from the immediate cause and working back to the underlying disease responsible. The terms which merely describes mode of dying like heart failure, coma should be avoided. If precise cause of death is not known, one should not start guessing it. Another example, that a child dying of toxemia in an attack of diphtheria, and it is sufficient to certify as in 1A toxemia for the last 2 days and 1B diphtheria for the last 4 days. And child suffering from measles, dying of pneumonia, complication of measles, will write in 1A pneumonia for the last 6 days and 1B measles for the last 3 weeks. So nothing should be written in 1C and section 2. These are a few more examples. Another example, that elderly man dying of hypostatic pneumonia after being bedridden owing to the fracture of neck of femur caused by fall from ladder. Then it should be written as number 1, hypostatic pneumonia 1A, and in 1B, fracture neck of femur for the last 7 days, and 1C, fall from ladder. So fall from ladder led to the fracture of neck of femur, leading to hypostatic pneumonia. Then few example of the underlying cause. A diabetic patient who had been under insulin control for many years suddenly dies of degenerative heart condition. Depending upon the fatal outcome by one or the other condition or both, the following entities are possible. Assuming that heart condition resulted due to the long-standing diabetes, the sequence would be 1A, myocardial infarction, 1B, diabetes, and that means the myocardial infarction resulted from diabetes. And if we write as 1A diabetes and 1B myocardial infarction, this would indicate that the diabetes has developed from myocardial infarction. So this is impossible. So sequence of 1A could not be due to 1B. So this is very important. Under no circumstances, a doctor should sign a blank or partly blank death certificate, because sometimes the young doctors are exhausted due to their long duty, and they the staff on duty or nurse says that this person is going to die, you just sign it and you go to rest, and we will disperse the patient by filling in the other particulars. Never ever do like that. This is an important legal document, and under no circumstances a doctor should sign a blank or partly blank death certificate. Thank you very much. Take care and Allah Hafiz.